Hello, my name is Delaney, and I work in the credentialing department at Magellan Healthcare. I bet you are wondering how you can qualify to serve as a provider in the Magellan Behavioral Health of Pennsylvania network. Well, you have come to the right place. Today, I am going to show you how Magellan credentials individual providers. We'll discuss the Council for Affordable Quality Healthcare Incorporated Provider Data Portal, which Magellan uses to review provider credentials. We'll talk about all the required documentation that must be uploaded to your CAQH provider profile. We'll also look at how the credentialing process works once Magellan has received your information. Magellan utilizes the CAQH provider data portal to streamline our credentialing process. Individuals wishing to participate in Magellan's provider network must complete and maintain a provider profile on CAQH. Here we are in the office of one of our soon-to-be providers. Individual behavioral health practitioner Dr. Hudson is beginning the credentialing process with Magellan. He will start by completing his CAQH credentialing profile in the CAQH portal. He also needs to make sure he submits all required documentation. If a CAQH credentialing profile does not include all required documents, there's a chance it may not be processed for credentialing. Let's take a look at all the required documents that you need to upload to your CAQH credentialing profile. First, you will need to upload a copy of your curriculum vitae or CV to your CAQH profile. Your CV should reflect at least the past 5 years of professional experience, including your current position. Your CV needs to show the start and end dates of service with month and year. Remember that CVs with years, but no months, won't be accepted. You also need to explain any gaps in your work history greater than 6 months. Your CV must also reflect your education information. Next up, we'll need you to upload a copy of your current professional liability/malpractice insurance policy information and/or face sheets to your CAQH profile. When completing your CAQH credentialing profile, you will need to ensure Magellan Health is an authorized entity so we can access your application. If Magellan sent you any additional forms or attestations to complete, please make sure to send those back using the instructions on the cover letter. Magellan's credentialing team will verify your credentials and forward your application to Magellan's Regional Network and Credentialing Committee, who will review your education, training and experience, specialty practice areas, current and prior actions on licensure, certification, facility privileges, and any malpractice settlements made on your behalf. You will receive a notification letter once the Credentialing Committee approves you for participation in the Magellan Healthcare Network. Once the Provider Data Management Department activates you, you will receive an additional letter letting you know you are ready to start seeing members as an in-network provider. Please note that in order to see members as an in-network provider, you must have an executed group or individual contract. As a provider in the Magellan Provider Network, your credentials will be assessed periodically through the re-credentialing process at least every 36 months, unless otherwise required. We will also evaluate your performance as a practitioner, which includes your clinical care, outcomes, member service, and how well you adhere to contract requirements. We are excited for you to join the Pennsylvania Health Choices Provider Network. Our partnership will help us deliver world-class behavioral health services and resources to our members in Pennsylvania. If you have questions about the credentialing process or inquiries about the status of your credentialing application, you can call Magellan's Provider Services line at 1-800-424-3711. You can find information about the credentialing process, the re-credentialing process, and much more in the Magellan Provider Handbook at www.magellanofpa.com.